Hi friends, welcome to our channel Global Health Helpline. Now I am going to talk about the second part of belladonna, including the points sensorium, head, eyes, ears and mucus, from the book, Lectures on Homeopathic Materia Medica by James Tyler Kent. Please subscribe our channel to be connected with us. Let's begin. Sensorium. Sensitive to impressions. Sensitive to light, to noise, to touch, to jar. The sensorium is violently excited. Excessive nervous irritability stands out, perhaps, as one of the most prominent features of bell. In contrast with medicines like opium that deprive the patient of all sensitivity. The more congestion there is in bell, the more excitability. The more congestion there is in opium, the less excitability. And yet they are very similar in many respects, very similar in aspect, in the appearance of the eyes and face, similar in pathological states. If I were to prescribe on the pathological state, the congestion of the brain, the appearance, without taking in the intensity of the one or other, I would not be able to distinguish between opium and bell. They often antidote each other. But we do not prescribe on pathology, but upon symptoms, after careful individualization. Vertigo. With this intense excitability, turning in bed, or moving the head makes him dizzy. Things go round. Vertigo with pulsations. Moving the head increases the pulsation, and the vertigo. The patient lies in bed, cannot hold the head up. This increased sensitiveness especially applies to the scalp. We notice it particularly in the woman. She cannot have the hair bound up. It is often the case that bell patients will not have the hair combed or brushed. Lets the hair hang down the back, so sensitive is the scalp. Hair feels as if pulled. Does not want the hair touched. There are some remedies that correspond to extreme irritation in very sensitive natures. Like hepa, where she faints with the pain, like nitric acid, when cannot bear the noise of vehicles going along the street, because it creates such violent sufferings, like cough-ear, where footsteps aggravate all the complaints. He was so sensitive to pain that the noise of one entering the door when he was on the third floor aggravated his sufferings intensely, though no one else could hear it. In nux vomica, even the sound of footsteps increases the pain all over the body. Bell has in its nature all this sensitiveness to pain. It is a part of the general sensorium, the whole bodily state is intensified. The chamomilla patient is oversensitive to pain, but we do not need to sympathize with the chamomilla patient, he will fight it out himself. But you will pity the belladonna patient, you will pity the pulsatilla patient, and the nitric acid patient. A strange part of it also is the reactive excitability. The reaction to medicine is so quick and so sudden that I have many times heard a patient say, before I had turned my back away from tea, he bed, that medicine has relieved me, so quick is the reaction. In many medicines reaction is slowed down, but in bell, it is intensified. So it is in nux vomica and in zincum. When the case is very acute, but sometimes also when the case is somewhat chronic, this sensibility is marked. Cuprum is so sensitive all over. It has sensitive warts, it has sensitive skin, sensitive polypi, everything sensitive, and it is so sensitive in its reaction that, when it is needed, partially indicated remedies will not work, because the patient is so oversensitive to everything that everything overacts. The smallest dose, the mildest dose, the simplest dose overacts and everything aggravates. Odors aggravate, well-selected remedies disturb instead of cure. Cuprum tones down, relieves that sensitivity, and well-selected remedies will then act curatively and long. Cuprum lacks it in that high state of congestion. It is not like bell, in that cuprum does not have that sensibility along with the active fever and congestion, the throbbing and disturbance of the circulation. But it has it in a chronic state. Women and children are so sensitive that they get no sympathy, and it is not suitable for hysterical ones either, but those that are not able to control themselves perfectly. Such is cuprum. We have medicines that are suitable to sensitive people, and especially sensitive women. Sensitive to odors, sensitive to every conceivable influence. The doctor who will go out and take care of these poor sick little mortals, who understands their nature, perceives their quality, and relieves them of their suffering will command the whole community, in spite of the reputation of all the doctors that are there before him. He must not be one who measures everybody by his own sensorium. He may be a pachyderm, but he will find patients that are sensitive. Head. This sensitivity is present in most of the bell headaches. There are stabbing pains, throbbing pains, shooting pains, all in connection with congestion. They are all sensitive to motion, to every jar, to light, even to the winking of the eyes. Sensitive to draft. Bell will be indicated when the head is rolling, the patient rolling the head because the pain is so severe he cannot keep still, although the motion increases the headache. A child lies and turns and tosses its head with congestion of the brain, screaming out with the brain cry, a sudden shriek. After a while it wakes up and commences to toss the head, and every few minutes it shrieks with that brain cry. It is going into a stupor, the neck is drawn back, the face is flushed, it is now becoming pale. There are times of stupor, and in that stupor the child cries out. In all brain troubles we must be careful about feeding much, or overloading the stomach, because the stomach is very feeble. It will not digest much, but the food should be well selected and light. Great heaviness of the head. The head feels like a weight, and is drawn back. Sometimes we see the head drawn back from contraction of the muscles of the neck when the membranes of the upper portion of the spine are involved. Again, we see the patient drawing the head back himself, because drawing the head back often ameliorates the violent headaches. This amelioration is kept up so long as he holds the head back. Aggravated from bending the head forward when sitting, from bending the head forward when standing, stooping. It feels as if the brain would fall out or push forward. This increases the headache so much that it sometimes turns into knife-like, or hammering pains. These are the expressions used. Sensation of nails and hammers, jagging and tearing. But with all pressure and throbbing. When rising from a seat these sensations are all intensified. Throbbing pulsation, like hammers hitting the inside of the sore skull, described by patients as if the inside of the skull was one continuous saw and was being pecked by hammers with every pulsation. Sometimes it will settle down while sitting still, or while lying, but rising up from a chair will set that hammer going. Expansive is an expression that is often used by the patient, and it was used by the provers. Expansive sensation, as if the head was enlarged, pressure from within out. All these headaches are relieved by pressure upon the outside. Sudden touch or pressure will aggravate, but pressure that is gradually increased and brought to bear carefully upon the head will ameliorate, like the pressure of a bandage, or a tight-fitting cap. Again, all of these headaches are brought on by exposure to the cold air, from standing in the cold air with the head uncovered. Sometimes a severe headache will come on from merely having the hair cut. Congestion of the head lasts for days, with throbbing and pulsating, from having the hair cut. Ear troubles, chest complaints, rheumatic complaints come on from having the hair cut, or from standing in the cool air with the hat off. So sensitive is the head to cold. It may be said of this remedy that complaints of various parts of the body come through the head and go downwards. Complaints in the lower extremities, rheumatic complaints of the joints with great redness and swelling, come on from uncovering the head, from exposure of the head, or from getting the head wet, or from being caught in a shower. There is one complaint which will puzzle you if you ever meet it and you do not know just what I am going to tell you. The complaints of in a general way are ameliorated from rest, and aggravated from motion, but there is a kind of restlessness with tearing pain from the hips down, most troublesome to observe, that keeps the patient walking all of the time. The instant there is rest the pains come on. They sometimes shoot downwards, they sometimes tear up and down the nerves, and this comes on from exposure of the head, and not from getting the feet wet. Complaints of aconite and pulsatilla come on from getting the feet wet, and these complaints rise upwards, come on through the feet and go upwards and affect the head. Complaints come on from exposure of the head and go downwards. Sometimes affect the head, sometimes the chest, sometimes the stomach, sometimes center in the abdomen, sometimes center in the uterus and ovaries. Brucious complaints from getting wet, but the complaints are in the parts that are wet. If he gets the legs wet he will have rheumatism in the legs. There is a vast distinction, and this distinction has to be made in almost every prescription you will make. Homeopathy is a matter of individualization as to how complaints spread. Some complaints begin on the right side of the body and spread to the left. Some complaints begin in the top of the body and go downwards. That is the way this remedy acts. In some remedies the exposure of the feet to an ice-cold draught will bring on headache, Colic. But in the exposure will bring on a headache, or neuralgia of the lower extremities. Now that pain that comes on from rest is an exception in that illustrates again the importance of distinguishing very decidedly between generals and particulars. Without knowing generals and particulars, you will never do accurate prescribing. The lower extremities here are the particulars. The patient and the general condition of the patient are ameliorated by rest. The symptoms of the patient are ameliorated by rest. All of those symptoms that can be predicted of the patient himself are ameliorated by rest, but the pains of the lower limbs, as described, those neuralgic pains are ameliorated by motion, and come on in rest. That does not mean that all the pains in the lower extremities are ameliorated by motion, because the pains in rheumatism are invariably ameliorated by rest, and aggravated by motion. Those tearing pains, from the hips downwards, with no swelling, come on during rest. All remedies are full of freaks, and it is the figuring out of these peculiarities that enables us to do good prescribing. With all the complaints a bell, do not lose sight of the congestion upwards. Rush of blood to the head. Cold extremities. Cold feet, cold hands, hot head. Eyes. Inflammatory conditions of the eyes. Glistening eyes. Dilated pupils. Flushed face. Intense redness of the inflamed part. Quote. Inflammation of all the tissues of the eyes, the lids, and all the parts of the eyeball, with most violent pain. Heat, redness, and burning. These three strong features that run through the remedy will be found in the eye sufferings. Pulsation, tumefaction, lacrimation, intense pains, sufferings all worse from motion, and worse from light. Most intense photophobia, flashes of light and flickerings before the eyes. When reading, lines appear crooked. Dimness of vision, or actual blindness. Intense congestion and fullness of all the parts. Apoplexy of the retina, half-opened, protruding, staring eyes. You will see that in the infant when the child lies in a stupor. Eyes half open, congestion of the brain, face flushed and intensely hot, rolling the head from side to side. If it has been going on for several days, the face will later become pallid, and the neck drawn back. In these congestive troubles, lying with the eyes half open, almost no winking. Orbital neuralgias, protruding eyes, with dilated pupils. Inflammation of the optic nerve and retina. Eyes congested and red. Quote. Another feature belonging to the eye is strabismus. Not those cases coming on gradually, such as will need the surgeon, but those that come on with congestion of the brain. With this state of congestion and dilated pupils and rolling the head from side to side, flushed face, throbbing carotids are. ND intense heat. After a day or two the eye begins to turn in, and the little one is cross-eyed. That is an additional indication for Bell. Sometimes, coming out of a severe congestion, the strabismus remains and Bell is sometimes the suitable remedy. All of these cases coming on from the circulatory conditions should be cured with remedies. They should never be sent to the surgeon. Though they remain some time, even months, they will be cured by well-selected remedies, while those that come on gradually, and those that are born so, will not be relieved by remedies. Only those spasmodic ones matter associated with, and come on from, congestion of the brain. In connection with congestion of the liver and duodenal catarrh there is yellowishness in the eyes. Ears. In inflammations of the ear which go on to suppuration Bell is rarely useful. We have to look to deep-acting remedies. We may have the pain, tenderness, oversensitiveness, all inflammatory conditions. But cases requiring Bell rarely go on to suppuration. Mucus. Now we come to the mucous membranes, the nose, mouth, throat, larynx, chest, the mucous membrane extending into the car through the eustachian tube, and we have another strong feature of Bell, which characterizes most of its conditions. Great dryness, a sensation of dryness. Dryness in the nose, mouth, the tongue, in the throat, in the chest, and such evidences as dry cough and spasmodic conditions. These are so general, that with the nose symptoms, the coryza, the throat symptoms, the cough, this is intensified dryness of mucous membranes will generally be found. It is that way with Foes. When Foes has a sore throat it will have dryness of the mouth, tongue and air passages. This is general as to the respiratory tract. Then there is coryza with much sneezing, pricking, burning in the nose, hot sensation in the nose. The general states present much redness of the face, much heat with the coryza, hot head, cold extremities, marked headache because there is dryness. The very dryness itself is sometimes causative of pain, because the natural flow from the mucous membranes is dried up. Whenever we have checked secretions we have fever, and in Bell, this is marked. Checking of the discharge with fever, with heat, redness and burning, red face, burning face, heat in the face and head, and cold extremities. It says in the text, maddening headache, with suppressed catarrh. Now, in such a climate as this most people during winter and cold weather and the changes have more or less mucus flow from the nose, and eyes, and air passages. They are better when this takes place. All at once it stops, and all the parts become dry, then look out. An awful, maddening, throbbing headache comes on. It is not so suitable for those old catarrhs where there is a copious flow of thick, yellow mucus. The catarrhal state wherein Bell is useful is simply the exaggeration of the whitish mucus flow. Where it has been thick and yellow, and then stops suddenly from a cold, and a coryza comes on, Bell is worthless. Always bear in mind that you select for suppressed catarrh a medicine that is within the sphere of the symptoms that have been suppressed. Hence, the medicine for thick, yellowish-green discharges might be Merck. sulfur, or pulsatilla, then you are within the range of medicines capable of re-establishing the flow, and at the same time beginning a curative effect on the state of the tissue, leaving the patient in a much better state. Thanks for watching full video. See the next parts by clicking on the link given in the description box.